Growing up as a child, I was told that the three things I needed to focus on to manage my blood sugar level effectively was my diet, exercise, and my medication. But then it's been 18 years living with type 1 diabetes, and I can tell you that those are not all. Like, it takes a lot more to manage your blood sugar level effectively. Like, there are a lot of things that affect your blood glucose level management, and I'm here to reveal those things to you. So hey guys, welcome to my channel. My name is Pere, and here I talk about diabetes, chronic health issues, and sometimes I impute things that are not related to diabetes once in a while. So yeah, and the aim of this channel is to help people who are living with chronic health issue, especially diabetes, find hope, find happiness, know about their health, cause awareness. That's the main thing. So so the main goal of this channel is to create awareness on diabetes so that people are able to understand their health and also find hope and joy while living with diabetes. So me myself, I've been living with diabetes for the past 18 years. I am a Christian girl who is also a registered nurse. So there's been a lot, a lot, from using my own self as an experiment, from knowledge, from and all that. So I'm here to share. So 18 years living with type 1 diabetes in Nigeria, I'll tell you that there are a lot of things that affect your blood glucose level that you are not told about. I don't think any medical personnel will tell you about this thing when you get diagnosed. And funny enough, these things are important to take note of so that you are well prepared, because diabetes require different management plan at different season. So when you are aware of the things that affect your blood glucose level, you are able to make effective plan. So going straight to the point, one of the things that affect your blood glucose level or can affect your blood glucose level is okay. And note that some of the things I'm going to be mentioning in this video may not be the same for you. It may be opposite for you. It may not really, be exactly the same because bodies are different. But these things are things that I have information I've gotten from both my own experience living with diabetes and also from a lot of other people who have been living with diabetes. So the most important thing is get to know yourself. So number one thing that can affect your blood glucose level control is the weather. So a lot of people don't know this, but okay. So a lot of people have testified that when the weather is changing, including myself, when the weather is changing, our need for insulin tends to change. Our need for diets, like our diet tends to change. And it has still not been figured out. Like, research has gone on and all that, but they've still not figured out why it is like that. But yes, the weather can affect your blood glucose level. For example, for me, each time it's like the rainy season, the cold season and all that, I tend to need more glucose and lesser insulin. I don't know why, and a lot of people have testified the same thing. But then for some other people, they tend to need more insulin and lesser glucose. So it's just noting what works for you and how it affects you and adjusting accordingly. So number two is being sick. And when I say being sick, I mean being sick outside diabetes. So if you're living in Nigeria, Africa, you know that things like malaria is not new to you. Things like malaria is not new at all to somebody living in Nigeria. And most of the time, how I know that I may have malaria or typhoid is by how my body is reacting to insulin. So once I just realize that my body is becoming resistant, I'm taking insulin and I don't know, my sugar level is just messed up and I'm doing everything right. Sometimes I go to, go and do tests to ensure that I don't have malaria, because anything that affects your immune system can have a huge effect on your blood glucose level. It can make managing diabetes way more difficult, and that is something that you need to take note of. And a lot of the time, once I deal with that malaria or that infection, phew, I'm back to normal. Like, surprisingly, I'm just back to normal and it's all good. Thirdly is um thirdly is hormonal changes. Now this is usually very much significant for the females. Like, it's very much okay. So this is pointing mostly to the females. So that time of the month where you're seeing, a period and things like that, those that can affect your blood glucose level. If you're a female, yeah, it can affect your blood glucose level. A lot of people have testified about this. And funny enough, it may not be straight ahead. Some people have testified that, oh, during their period, their blood glucose level just goes high, and once their period finishes, just goes low. But for some people, they notice that their blood sugar level just keep dropping. My own has been mixed, like way mixed. Sometimes it's high, sometimes it just goes low, 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 low. So I, and I think that has to do with your hormones, like the changes in hormones, estrogen, progesterone, and things like that. And not only that time of the month, but also when you are of childbearing age, when you're pregnant and all that, that can have a big big influence on your blood glucose level. And even if you're a person that is experiencing hormonal imbalances, like in cases of like you're experiencing hormonal imbalances, that can affect your blood glucose level, because insulin is an hormone, and it's not just an hormone that, the pancreas and all that, it affects the blood. Diabetes affects the blood. So anything that has to do with the blood, infection, no, hormone, no, it can affect diabetic control. So another thing that can affect diabetic control is stress and sleep, lack of sleep. Now, these are two different things, but because they have a similarity in how they work, that's why I'm putting them together. So when you are stressed or when you are not sleeping properly, there is a high level of cortisol. Cortisol is a stress hormone, and what cortisol does is that it makes the body resistant to insulin, like your body start having issues with the use of insulin, and that can make your blood sugar level just out of control. Imagine you're already having resistance, and now you're dealing, your body is not making use of the insulin again and all that. It can just make it all bad. And that's why we advise people like sleep well, sleep when you need to sleep. um stress is different from exercise, please. Stress is different from exercise. Exercise increases your serotonin, dopamine, and all that. Stress increases your cortisol, which leads to resistance. So you have to learn to differentiate the two and work on it. So another thing is mental health disorders. So as a girl who used to live with anxiety disorder, I can tell you that anxiety disorder can affect your blood glucose level. Why? Each time you have anxiety and things like that, it can affect your adrenaline issues. It can cause adrenaline issues, release of so much adrenaline in the blood. And one thing adrenaline does is that it makes your body less receptive to insulin, because you need that energy for flight and fight response. So it can affect insulin control. It can affect, so if you're dealing with things like mental health issues, be it depression, anxiety, whatever it is good for you to see your doctor so that people can work something out. And see a good doctor, please. Yeah, exactly, see a good doctor. Now, another thing, I think this one we already know, like I mentioned in the first video: exercise, your diet, and your medication. These things can affect your blood glucose level. I think we already know this. Most of the time, we are actually educated on this, but I just said I should put it so that we remind you: watch your diet, watch your meal. So another thing that can affect your blood glucose level is your weight. I think a lot of people do not know this. Whether you're a type 1 diabetic or whether you're living with type 1 diabetes or type 2 diabetes, you need to watch your weight. It is very, very important. And the reason is because fatty cells can affect how your body is receptive to insulin. It can, even for type 1 diabetes. I mean, research has just released that there is something called double diabetes, whereby a type 1 diabetic become resistant to insulin. Now imagine your body does not produce insulin, and then the one you are injecting yourself, your body now become resistant to it. So it can happen, and a lot of times one of the risk factor for that is your weight. Once you start having a lot of fatty tissues, high cholesterol level and things like that, it can affect how your body is receptive to insulin. So yes, even as a person living with type 1 diabetes, you need to watch your weight. So another thing that can affect diabetes, I think I had to experience this to know, is medications. There are some medications that can affect your blood glucose level, especially medication like steroids. I mean, steroids and diabetes do not agree at all. They don't agree at all. So a lot of times when people are having some really, really bad allergy, like when I say bad allergy, I mean there was a time in my life where I had really bad allergy, like I was reacting to almost everything. It was so bad that it could almost knock me unconscious, and they had to put me on steroids. And that was when I found out that steroids can affect your blood glucose level. I mean, one of the first things the doctor said was, you know what, go to the lab and test your blood glucose level and your HbA1c before we give you this medication. And that's when I first realized that there are some medications that diabetics normally should not take, except it is really, really needed. And even till now, where I'm managing asthma, I'm living with asthma also. Steroids. Oh my god, steroids. Steroids affect blood glucose level, and you should be very careful. You should be careful with the kind of drugs you take. There are also other medications that can affect your blood glucose level, and the management can make it very difficult for you to manage your blood glucose level. So please and please don't just, if you are a person that do self treatments, self medication and all that, please, you will want to check that out. Always confirm your medication with your doctor. Very, very important. Now, lastly, I think this is the last thing I'm going to be talking about. One of the things that can affect your management is if you have another health issue, another chronic health issue. Now, this can be things like PCOS, cancer, renal issue, that's kidney issue, liver issue, whatever it is, can affect your diabetic management very well. It can affect how your body uses insulin. For people who have kidney issues, a lot of the time you have to be careful with insulin because you can send them unconscious into hypo. You can send them into hypo very fast because the body is not able to excrete things like the kidney is not able to excrete, a part of the insulin that is supposed to excrete normally. And so there is so much insulin in the body and can lead to excessive insulin in the body, leading to low blood sugar that can knock them unconscious. People who have, cancer, sometimes from the medication, sometimes from how it affects the hormones in the body. Sometimes it can just be different thing. But then when you have other health issues, for example, PCOS that messes up the hormones in the body, that can be an issue and can affect how your blood glucose level is controlled. So being knowing this means that you have to like pay more attention, report to your doctor, have a good doctor, report to your doctor when you're experiencing these things, and be on top of your game. So knowing these things helps you to be on top of your game. So you know that when you are facing issues, you are able to trace it to, okay, what's happening? Am I not sleeping well? Am I not eating well? Is there another issue? And you're able to address it and be on top of your diabetic management game. So I do hope that this video helps you to identify those things, help you to know why your blood sugar level is not being well controlled. And if you've not subscribed, also, you are here, you've not subscribed, please subscribe and support the channel. We are trying to cause awareness on diabetes all around Nigeria and all around the world, so please do. And God bless you. Thank you for watching. Bye.